Hello and welcome to Teeth Time, where I, Dr. Sharifa Tartusi, sit down and speak to you about all the things you wish your dentist would just tell you in plain English. Usually there is a cup of tea accompanying. It will make an appearance and yeah, welcome. Today we'll be talking about the most frequently asked questions that I get asked by the parents and guardians of my pediatric patients. School holidays are coming up or have just ended, and it feels like it's usually a really good time to get your kids into the dentist, but there are so many questions and sometimes you just want to know before you even see the dentist, so this is that. The first question I want to answer today is one that we get asked before the patient's even in the chair, and it's, how old should my child be when I first take them to the dentist? And that's a really valid question. You don't want to take them too early and be paying for a service that you don't really need, and you don't want to take them too late and feel like they've missed out on an essential health service that they need access to. It varies, but the youngest patients that I see are about 2 years of age. It's usually a really good age because they're at an age where they're kind of animated, they're making full sentences, they can communicate with you, they understand instructions, and we can get them in, get them a little bit used to the chair. We'll have a look at their teeth, we'll count their teeth, make sure that they feel nice and comfortable. Usually at 2 years old, unless there is any issues that we really need to take care of, the visit is really there to make sure that the patient or the child is comfortable coming and seeing the dentist. It's a lifelong habit that we need to build in our kids, and that's really the purpose of it. Here in Australia, there's a really good government initiative that provides the funds for most of the patients or most of the kids to come and see me at about 2 years of age. So there's the answer to that one. Another one they get asked very frequently is also got to do with age, and it's, how old should my child be when I start brushing their teeth? The answer is, the moment that there is a tooth in your child's mouth, you should be taking care of it. Just, you don't even need toothpaste when they're really little and they're about 6 months old. Just make sure that you get all the plaque off of whatever teeth they have in their mouths. Then they get a little bit older and we can start introducing toothpaste. I wouldn't recommend letting your kids brush their own teeth without any supervision or checking afterwards until they're about 7 or 8. The reason being that children don't have the manual dexterity that adults do. They don't have the diligence that adults do. They don't really understand why they're brushing their teeth as much as we do. So all of those factors together culminate in the likelihood of the brushing being done right being quite low. So you would want to be brushing their teeth with them until they're about 6 years old, and then after that you can just check afterwards to make sure that they removed all the plaque. The next question is an interesting one because it's one that I feel I get asked a lot, more than I expected, but it is, at what age should my child stop using a dummy? In terms of teeth and making sure that we're not getting any orthodontic issues, ideally before age 3, definitely before age 5, before the molars come in, because the moment the molars come in, we start to have a lot of problem. That's because there's been a dummy in there and it's prevented the teeth from touching. Our teeth touching continuously creates the alignment of our teeth, and if we're not getting that alignment happening early on, we're going to get something called an open bite, and as the name suggests, it means that the teeth are not really touching when the child has got their jaw closed. And then we're going to have to send them to an orthodontist. That's if the molars have come through. So if we can try and get the dummies out of children's mouths before age 3, that would be completely ideal and will save you a lot of heartache later on in life. The other thing I get asked about quite a bit is related to this. It's bottle feeding. We don't recommend that you give your child a bottle and let them fall asleep with milk in the bottle, because there is a stagnation of the milk in their mouth. The products in milk will break down to sugars, and then they'll end up getting what we call early childhood caries, or really, really early decay in their teeth, which commits them to a lifelong kind of cycle of having their teeth filled. And it's not very pleasant for adults to get fillings done and procedures done in their mouths. It's much less pleasant when you don't know why it's happening. So just to avoid that, we don't recommend having children fall asleep with bottles in their mouths. Another frequently asked question is, which toothpaste is appropriate for my child? We don't recommend an adult toothpaste for children. You can go to any supermarket and grab any children's toothpaste and it'll have a less concentrated amount of fluoride in it. I'm one of the dentists who does recommend fluoride. I think it is really, really effective in preventing cavities in children and adults, but children should not be exposed to as much fluoride as adults, only because they can suffer from something called fluorosis. That's when there's so much fluoride in their toothpaste that they end up getting a cavity-like appearance. Generally, the best toothpaste for your child is the one they're going to use, so I don't care what flavor it is, I don't care where it came from, as long as it has fluoride in it and your child is using it, and I mean that in the nicest way possible. The next one is, my child has stains on their teeth, what should I do? If your child ever has any stains on their teeth, dark spots, if they're in pain, go and see the dentist. Get your peace of mind. If they've got stains on their teeth, we can always take them off for them. If it's decay, then at least we've caught it early. The thing we hate to see as dentists is things that have been left really long and now the child has to go under anesthetic or needs to have these really extensive procedures that will effectively traumatize them for a very long time. The last one I'm going to cover today, my child has tooth decay. So what can I do to make sure this doesn't happen again? How can I improve the situation? Just as we say for adults, it's diet and it's oral hygiene. Make sure that your child is brushing their teeth morning and night and that you're helping them do it. That's the first thing that you can do. We don't recommend that children floss. Their gums are structured differently to adult gums. Little kids shouldn't floss. We recommend they start flossing when they start to get their adult teeth. So that's not something that you need to be doing. The second thing that we really recommend is changing their diet. A lot of the little kiddies who come in to see me who have a lot of cavities in their mouths absolutely love their sugars. Now, sugar is tasty. I'm never going to tell anybody to stop eating sugar altogether because I know that that's really difficult, especially with the modern Western diet that we consume today. But I am going to say there needs to be a limiting of sugars. Treats at birthdays are okay. Once a week on a Friday as a treat for the week is okay. But having sugar every single day, we don't like to see that in kids. The first thing you can do is cut that out. It's a little bit of sacrifice. It's a little bit of just making sure that those sugars are not there. If you're going to give them a treat once a week, that is fine, but do it at mealtime. I have a video on cavities that you can find on my channel that will tell you why that's a thing. The other thing that we talk about is protective factors. So we think of sugars as contributive factors to decay, and there are things that we can do to protect. So milk, dairy, hard cheeses are going to be really great for that. Obviously don't fall asleep with a milk bottle in your mouth, but giving them milk in the morning, making sure they have their dairy is absolutely a great thing. There are also things that your dentist might recommend, like tooth mousse. Obviously don't go out and buy it if you don't need it, but if your dentist recommends it, definitely. That concludes the episode for today. I hope this was informative. As always, it was lovely chatting to you guys, and I will see you at the next episode. That is all there is to it.